It's always a great pleasure to have you join us on Healthy Living with yours sincerely, Oluije Oikokai. Today on Healthy Living, we'll be looking at understanding clubfoot, early detection, treatment, and herb for every child. Now, it will please you to know that in 1,000 children, 1 in 1,000 children come down with clubfoot. Now, to do that with us, to guide us, educate us more on clubfoot, is the person of Dr. Uduwari Omorogiwa. He is the consultant ophthalmologist, orthopedic surgeon, and clubfoot clinic coordinator, University of Benin, UBTH. Good afternoon, sir.
Good afternoon, madam. Good afternoon, viewers. Thank you for having me.
Okay, clubfoot. Why clubfoot? What is clubfoot?
Thank you very much. Clubfoot is a deformity of the foot that usually occurs in children. It usually involves the foot being turned inwards and downwards.
Okay.
It is very important, as we said earlier, that clubfoot, the incidence, global incidence is about 1 in 1,000 live births.
Yeah.
And it has also been found in Nigeria that we have about greater than 10,000 newborns with clubfoot every year, necessitating us to promote the importance of patients who have this disease to come in for treatment. And the beautiful thing about it is that clubfoot is treatable.
Okay.
With this high level of burden in Nigeria, and then late presentation and low awareness, this has resulted in many of these patients presenting very late, and then many of these patients living with this disability. It is a treatable condition. However, if these patients do not present early, they present very late, it will now result in them having complex surgeries. And even despite the complex surgeries, they will have disabilities remaining. But for patients who present very early, they will be treated non-operatively. That's without surgery. This will involve what we call the Ponseti method. By the Ponseti method, it involves manipulation of that limb. Because in the deformity, as I said, the foot usually is turned inward and downward. So what we do in correcting that deformity is to return it, back to its, original, the normal form. And when we return it to its original form, the normal form, we cast it. We call that return, that manipulation. Through that manipulation, we stretch the foot and return it to its position, and then we apply a cast from the toe to the groin. After applying this cast, the patient will have this episode done repeatedly. And once this is done repeatedly up to 5 or 6 times, by the time we have done this up to 5 or 6 times, that deformity, what you are seeing on the screen now, will be corrected. And then we'll now place the patient on a brace. The patient will wear this brace from that completion of correction to about 4 or 5 years. But in the initial phase of the brace wearing, the patient will wear that brace at least 23 hours of every day. The only time the brace will be removed is when the mother wants to bath the child. So we have the brace put on 23 hours daily for the first 3 months. After that, the child will have the brace being worn only at night until the child is 4 or 5 years. And you know, the beautiful thing of this simple correction is that the deformity is completely corrected. This child that you are seeing on this screen now will not be able to wear a normal shoe, and then the leg will be pain-free and be able to walk just like every other child, be able to do just every other thing that any other child can do. There are different types of clubfoot. Another name for clubfoot is called congenital talipes equinovarus deformity. It could be congenital, it could be acquired. The commonest form is the congenital type. Within this congenital type, we have the idiopathic type. The idiopathic type also makes over 90% of the clubfoot you will see. And the beautiful thing about this idiopathic type is that it is correctable by this simple method that I explained earlier, by simply manipulating and then casting. A few will come with complex or syndromic clubfoot, that is, they come with other associated abnormalities.
Yeah.
Those are a few. Even in those ones that come with other associated abnormalities, we start with this manipulation and casting.
Okay.
That is it.
Okay. Now you talked about early detection, coming to the hospital early. So how early should a parent, after noticing this, how early should a parent take the child to the hospital?
Thank you very much for the important question. As soon after delivery of this patient.
So immediately after?
As soon after. We usually advise that within 1 week of birth, the patient should present. The reason is this. Early treatment brings better outcome. So for patients that are presenting within the first year of life, within the first 2 years of life, we found out that they will have better correction, complete correction, as against patients presenting 5 years of life or 10 years of life. Though we can use the simple method, we call it the Ponseti technique as I described, to correct even up to 10 years. But we find out that as the patient ages, present late, the outcome becomes poorer. Because why? By that time, the bones are becoming stronger. As you said, the ligaments, the tissues, they are all already taking forms. And then also because the patient has been bearing weight, that's working on it, there will be presence of callosities at the side, with the patient presenting with even more severe deformity. So we advise, before the patient start walking, so as soon after birth, whether the child is delivered at the health center or delivered in a bigger hospital, like a state hospital, they should present early. Because when they present early, the deformity can be completely corrected and the child's foot will become normal. Okay,
now I know some persons watching us out there will want to know, what are the causes of clubfoot? Is there a way when a mother is pregnant, there'll be a way to know about all of this?
Thank you very much. Clubfoot, yes, when a mother is pregnant, that's why we encourage every mother to register for the antenatal clinic. And it is important in this modern day that every mother that is registered in a routine antenatal clinic should have ultrasound scan done. At least should have at least 2 ultrasound scans done.
Before the delivery date?
Yeah, before delivery. Clubfoot can be detected intrauterine. That is when the baby is in the mother's womb. The deformity can be detected. However, the treatment will commence when the child is delivered. That is what can be done. There are various causes. However, majority of clubfoot are idiopathic. What do we mean by idiopathic? We mean that there is no known cause. But there are risk factors and there are theories that have been postulated that are responsible for this clubfoot. One cause is, we call it positional clubfoot. Is that, for example, a mother with multiple gestation, it can be twin gestation, it can be triplet, because of overcrowding in the uterus, and because of the baby's foot may be abnormally placed in the uterus, the baby will then maintain that abnormal position, which is a club-like position. And then the baby is delivered like that. So that child will have clubfoot, but that clubfoot is called positional clubfoot. And that is easily corrected, because why? The child's foot is flexible, and with little manipulations and casting, the method I've described as the method for treating this, then the deformity is corrected and the foot becomes normal. Also, we have also linked some genetics to clubfoot, because it has been found that parents who have clubfoot, their children, some of their children may also have clubfoot. In fact, the incidence increases to 1 in 3, where both parents have clubfoot. So if both parents have clubfoot, 1 in 3 of their children may have clubfoot. This is what we have. And then also, for parents who have delivered and maybe a previous child with clubfoot, there's an increased risk for them also having another child with clubfoot. So these have been linked to clubfoot. Then there are also those that we have said that they are syndromic. That is, they come with other conditions. Other conditions are still with the clubfoot. And then there are those that are acquired. But our emphasis here is for those presenting with idiopathic clubfoot. The reason is because greater than 90% comes with this idiopathic clubfoot. And this idiopathic clubfoot, usually they present as an isolated condition. What do you mean by isolated condition? That is, the child only has the deformity on the foot. No other deformity, no other complaint, no abnormality in that child's body. The only abnormality that the mother will see at delivery is that the foot of this child, whether 1 or 2, is like a club-like. You know the club-like that you use in playing golf? Yes, that's it. It's not like a club-like. So the mother notices the deformity at delivery. And majority of them, because majority of them are idiopathic, no cause can be attributed to it. They are correctable by the simple pon-setting method, which is just by stretching. This stretching is called manipulation. It is stretching, it's called manipulation, but it's a systematic manipulation.
So invariably we're saying this stretching, it's not surgical.
It's not surgical, but it must be done by trained hands. Trained hands who understands how to do it, when to do it, what position to do, which deformity to correct, because the clubfoot itself, as shown by the picture that was shown on the screen previously, consists of basically 4 deformities. We call them the Carver's deformity. If you look at the foot is high-hacked. Then it has 4-foot adduction. You can see the front part of the foot is turned inward. The inner part of the foot, which is behind the heel area, is also turned inward. Then you see the foot is turned downward. The ankle will be bent downward. These are the 4 deformities: Carver's, 4-foot adduction, heel varus, and ankle equinus. We know the way a horse's foot is. That's why we call it ankle equinus. The horse's foot is like it's pointing down. So you can see it's pointing down. It's called the ankle equinus. So those are the deformities. Systematically, the deformities is corrected with the Carver's deformity, which is the high-hacked, being corrected first. So from there, we go to the 4-foot adduction, we go to the heel varus, and then we go to the ankle equinus. And that ankle equinus, we correct it just by using a surgical blade. Using a surgical blade, we're able to release the tendon. Well, I think majority of us out there will know what we call the Achilles tendon. If we touch the back of our leg, lower down the back of our leg, you feel a strong tendon. When you bend your leg, whether you bend it down, you bend it up, you feel a strong tendon. That tendon in children who have clubfoot, that tendon is usually very tight. It is tight and it's responsible majorly for that foot to be bent downward. So what we do after correcting the other deformity, I mentioned, for that one, we simply use the surgical blade to release it. We release it so that the foot can become plantigrade. That means the foot can become flat on the ground. Yes. So that's what we do. So it must be done systematically, and it must be done by a qualified person. It must be done at the time it's supposed to be done, and then it must be followed up.
Let's take a look at treatment.
Thank you very much. You see, clubfoot is a treatable condition. As I said, majority of the patients, greater than 90%, will present. That's greater than 9 out of every 10 patients will present with idiopathic type, which is easily treatable using a method we call the pon-setting method. Just by manipulating the foot back to its normal position, stretching it, and then applying plaster or pari cast over it. We'll be able to correct this. And after correcting, we'll now place the foot on a brace. It is important that the mother will follow through with that bracing up to 4 or 5 years. But the first 3 months of it, the child will be on the bracing for at least 23 hours a day. Then after that, completing that, then for 4 to 5 years, the child will be on nighttime bracing. So you see, it's very flexible and it's very easy. However, many patients will not come, and when they don't come, mothers don't bring their children because those child they are young and they can't take decision by themselves. They are left to suffer. This child, they move about with this disability and deformity until adult age. And
this is something that is curable.
It's treatable and curable. Complete. Greater than 90% will be cured just by that simple method. That is it. But if they fail to come, the child will grow with that, and you see this child walking on the lateral side of their foot.
But what do we think is the reason for a parent not to want to go further to know if there are solutions to the child's health, especially when it comes to clubfoot?
Thank you. One challenge is lack of awareness.
Knowledge is power.
Knowledge is power. That's why we are here also talking about it. Some are not aware that these conditions are treatable. In fact, another challenge that some of them, they have knowledge that, okay, they can treat it, but they have the wrong knowledge. So they take these children to traditional bone setters, where scarification marks are placed. In fact, worsening these children's conditions, causing infection. They will use all kinds of blades and put and cause problem for these children. And meanwhile, this is a condition that is easily treatable in the hospital. You know, the beautiful thing about it is that it is treated free of charge.
Okay.
That's the beautiful thing about it. At the University of Benin Teaching Hospital, we treat them free of charge. It's just for you to present your child. Bring your child. We will assess
early enough.
Early enough. Bring your child early enough. We will assess the child. Having assessed the child, we will start the treatment. And then you get the brace free of charge. Courtesy, we have the Miracle, some foundations, NGOs that helps us with these braces, so that the Miracle Fit, they give us free of charge. So we're able to give to this patient free of charge. The only thing the mother will do is just to bring the child to the hospital. And then it will solve this. But if the challenge is, if the mother don't bring the child to the hospital, he will leave this child with a disability. There's economic loss. A child that is supposed to maybe be a footballer, because the leg is abnormally placed, cannot play football.
And the stigma. And
the stigma. Many of them are ostracized from their friends, or their friends, when they see them, say, that child that has that leg like that. Meanwhile, this is a condition that is treatable. And the treatment is not even far. You don't need to travel far. The treatment is here in Benin. So you can come to UBTH. Our clinic days are Mondays. Every Monday, we run the CLUBFOOT clinic from 9 a.m. From 9 a.m. to 2 p.m. You can come and you get free treatment. But just bring your child as soon after birth. Ask the doctor, ask the midwife, ask the nurse when after delivery, that this condition, what it is the condition. Okay, please, can I go to UBTH to see for care? You can come. We will assess it and then we will treat you.
Okay. All right. So is there a particular routine drug that a parent or a mother ought to take during pregnancy to, you know,
to prevent this?
Prevent all of this.
Okay. Thank you very much. As I said earlier, I said the majority of the CLUBFOOT is idiopathic. That is, there's no It is not due to the drug the mother took during pregnancy or one thing the mother did during pregnancy, but there are risk factors. Some of those risk factors I said, in the setting where there is multiple gestation, a mother has, they could have positional CLUBFOOT. Then in setting also where the father or the mother or the siblings have CLUBFOOT, there could be. But there are, it is not because of a drug or whatever. There are a few that are part of a syndrome. Usually neurologic syndromes, such as spinal bifida, there are components of it, or children presenting with cerebral palsy. They also have the CLUBFOOT as a component of it. Those ones are a few. And those few, we have to treat them holistically. Though we will still start with this simple method in correcting it. All right.
So your advice to everyone watching us right now?
Thank you very much. My advice to everyone watching us, whether you are a mother or you know a mother, whether you're a mother or you know a mother that has a child with this CLUBFOOT, please direct them to the University of Benin Teaching Hospital CLUBFOOT clinic.
But before you say say go there, at what age is it a no-no to this treatment?
Thank you. It is treatable at every age.
Oh, at every age.
However, for non-operative treatment, which we advocate, which is the best, and for the foot to return back to normal, we'll encourage them to present at least less than 2 years. However, up to 5 years, 10 years, we will still succeed with using that non-operative method. But when you are presenting above 10 years, the treatment has to be surgery. And the outcome will not be as better as if you are presented early. And you will now have to go through complex surgeries, and with the child having several complications from it.
Okay, you have heard it all. We've been talking about CLUBFOOT, how important for early detection. You as a mother, as a father, even a friend out there, and the mother is wondering, what can I do about this child? Some mothers are actually shy, talking about societal pressures and all of that, not wanting to take the child out to go seek for solutions. So we're telling you today, you need to stand for yourself and for your child also. Take that child to the hospital today. We'll be seeing again next week for another exciting time on Healthy Living. Do have yourself a blessed day. Bye for now.